Good afternoon, students. Welcome in HCP lecture. Today's I will start the lecture of hospital and clinical pharmacy. In that, part 2, that is clinical pharmacy. And in this lecture, I will start the remaining part of drug interaction. Let us firstly shortly look at the what we saw in previous lecture. Okay. Introductory part of drug interaction. Then reasons of drug interaction, then role of pharmacist in drug interaction, and mechanism of drug interaction. In mechanism of drug interaction, pharmacokinetic, we have seen previous lecture. Okay. In firstly, see the reasons of drug interaction. In reasons of drug interaction, what we saw in previous lecture, use of OTC drugs, then patient non-compliance, then multiple physicians and drug abuse or misuse, then potent drugs. These are the reasons of drug interaction. Then next point is role of pharmacist in drug interaction. In that, he is ideal person who can play a vital role in preventing interaction of drug by advising the patient on the following. First is do not use OTC drugs without the consultation of physician, and second is strictly follow the instruction given by the physician regarding administration timing and doses. If receiving treatment from multiple physicians, inform them about the illnesses before taking the medicines. Okay. Next is do not consume drugs in excess apart from recommended dose. Then do not take different drugs at once. Then which type of the food is forbidden for the particular drug. These are all about the role of pharmacist in drug interaction. Then next point is mechanism of drug interaction. In that, pharmacokinetic. First point is GIT absorption, second is alteration in distribution. In GIT, change in pH, then absorption or complexation of drugs, then GIT status or other factors. Then C is the change in metabolism, that is in that enzyme induction and enzyme inhibition. Then fourth is change in excretion, in that pH of urine and competitive excretion. Now I will start the next point, that is pharmacodynamic interaction. Okay. Pharmacodynamic interaction. First is drug having opposing pharmacological action, that is also known as antagonism. Taking at time two drugs having a opposite pharmacological action is called as antagonism and may be given to the patient by physicians for different illnesses. Then second is drug having a similar pharmacological action. When two drugs are given at a time to a patient which acts on same physiological system, this results into the additive or synergistic effect. In that, the combination of ephedrine and aminophylline for asthma. Then procaine and adrenaline increases in the duration of action of procaine. Then calcium ions gives synergisms with digitoxin in hyperdynamic heart. Then third point is drug competition at receptor site. In that, this may occur at same receptor site with same target organ. The effect is produced after binding of drug at receptor site. Two drugs administered together may compete to bind with same receptors, and it depends on first is the availability of free site at the receptor binding and the affinity of both the drugs for the receptor binding. Okay, these are the drug competition at receptor site. Then next is change of electrolyte level. Okay, change in electrolyte level, in that effect of drug can be modified due to change in fluid and electrolyte level. Okay, then next point is drug interaction. The mechanism of drug interaction. Firstly, see the mechanism of drug interaction in that pharmacokinetic and pharmacodynamic, okay, interaction. Then in pharmacokinetic in pharmacodynamic interaction, drug having opposing pharmacological action, that is also known as the antagonism. Then drug having similar pharmacological actions. Then drug competition at receptor site and change of the electrolyte level. Then next is drug interaction. First is analgesic drug interaction. In the analgesic drug interaction, first is combination. Then second column is mechanism of interaction and clinical significance. First is in analgesic drug interaction. First is aspirin and probenicide combination drug. Then mechanism action of these both drugs. The both compete for same binding site on plasma albumin. Okay, both compete for same binding site on the plasma albumin. Then clinical significance of these both drugs of aspirin and probenicide, that is uricosuric action of probenicide is decreased. Uricosuric action of probenicide is decreased. Then second combination is aspirin and heparin warfarin. Aspirin, heparin and warfarin. Okay, the mechanism of interaction of these drugs is aspirin potentiates the activity of anticoagulants by the interfering with binding site and decreasing the platelets activity. Then clinical significance of these drugs is change of the mucosal bleeding are very high. Example as the nasal and gastric. Then during oral anticoagulant therapy, aspirin should be avoided. These are the clinical significance of aspirin, heparin and warfarin combination. Then third drug of analgesic drug interaction, the combination of aspirin and urine alkalinizers. In that mechanism interaction is change in the pH of urine towards the alkaline, which inhibits reabsorption of aspirin at renal tubulus. Okay, change in pH of urine towards the alkaline, which inhibits the reabsorption of aspirin at renal tubules. The clinical significance of this drug is aspirin serum concentration is reduced, and a physician should not prescribe both these drugs at a time. Okay. Then next is diuretic drug interaction. Okay. Diuretic drug interaction in three combination, furosemide, thiazide and antidiabetics. Second is thiazide and antihypertensive, and third is thiazide, acetazolamide and quinidine. Okay, these we have seen in next lecture. Okay, I will revise the today's part. First is pharmacokinetic interaction. In that, drug having opposing pharmacological action, that is also known as antagonism. Taking at time, two drugs having opposite pharmacological action is called as antagonism. Then second is drug having similar pharmacological action. Then third is drug competition at receptor site. Then change of the electrolyte level. Okay. Then next point is drug interaction. Okay, in that first is analgesic drug interaction. In three combinations of analgesic drug interaction, aspirin and probenicides. The mechanism interaction of this combination, both compete for same binding site on the plasma albumin. Then clinical significance, uricosuric action of the probenicide is decreased. Then second is aspirin and heparin warfarin, that is mechanism interaction is aspirin potentiates the activity of the anticoagulants by interfering with binding site and decreasing platelets activity. The clinical significance of this combination is change of mucosal bleeding are very high. Example is the nasal and gastric. Then during oral anticoagulant therapy, aspirin should be avoided. These are the significance of aspirin and heparin warfarin combination. Then third combination is aspirin and urine alkalinizer, that is mechanism interaction is changing the pH of urine towards the alkaline, which inhibits the reabsorption of aspirin at renal tubules. Then clinical significance is aspirin serum concentration is reduced. The physician should not prescribe both these drugs at the time. Okay, the next point we have see in next lecture. Okay, I will stop here. Thank you.